Hi, I'm Rachel, and this is Conversations with Dental Friends, the go-to podcast for dental professionals who want to uplift themselves and their colleagues, love what they do, and realise their dental dreams are absolutely within reach. This week, we're getting straight to the point, quite literally, with an episode all about orthodontics, featuring the brilliant Dr. Emma McCrory. Emma is the founder of Lisburn Orthodontics, a modern patient-friendly practice that not only delivers incredible results, but also focuses on team growth and creating a supportive, thriving workplace. Before we dive in, a quick favour, if you haven't already, if you could just hit follow wherever you listen. It takes just a few seconds, but it makes a huge difference to the guests we can bring on, and it means every new episode lands straight to your phone without you even having to think about it. All right, let's jump into my conversation with Dr. Emma McCrory on building her dream practice and all things orthodontics. This podcast is sponsored by VistaSoft 4.0, the latest innovation from Dürr Dental's VistaScan product line. VistaSoft 4.0 brings the power of AI directly into your workflow with smart tools like VistaSoft Cloud Drive, in-text image functionality, VistaCloud and VistaAid, all protected by cutting-edge cybersecurity. Whether you're working with intraoral, panoramic, cephalometric or 3D images, AI-enabled filters automatically adjust brightness and contrast, delivering sharper, clearer X-rays for more confident diagnosis. Take your digital imaging to the next level with VistaSoft 4.0, the future of precision dentistry. Contact your Dürr Dental partner today to learn more. And of course, a huge congratulations to Ortol celebrating 60 incredible years this year. Happy birthday, Ortol. Here's to many more years of innovation and excellence. I truly couldn't imagine the dental industry without you. So happy birthday from Conversations with Dental Friends. Welcome to Conversations with Dental Friends, Dr. Emma McCrory. Emma and I have been Instagram friends for a while, and we've just worked out that I'm friends with Emma's cousin, which is the case all the time at Northern Ireland, of course. But I remember following your page, Lisburn Orthodontics, or no, Dr. Emma, I think was your page, first, and I remember following that, and here we are now, all these years later. That must be like 5 or 6 years ago.
Yeah, definitely.
So let's rewind a bit. Take us back to where it all started. What initially drew you to dentistry, and how has your career evolved to where it is now?
I suppose it all started back at school when you're sort of picking your subjects.
Yes.
And I was picking subjects for A-level, and maths was my favourite subject. So I had a teacher
Love maths, yeah,
who was, really encouraging me down that path. So I suppose, especially when you're in that school system of sitting exams, you're trying to pick a career based around what you love.
Yes.
And so I automatically thought I'll be an accountant because I love maths.
Yes.
And so I was picking subjects around that. And then I had a teacher, Mrs. Flanagan, who I still vividly remember sat me down one day and she said, I really don't think this is the career for you. She said, really? Accountancy is a great career, but you're a people person and you're not one to be sitting behind a desk in an office.
With books.
Yeah, stressed at Christmas, trying to work out tax. And she said, I think you're quite creative and I think you're quite personable and you should be thinking about a career, something like that.
Isn't it funny how they always know?
Yeah, absolutely. I would love to see her someday so I can thank her. But I went away and chatted to mum and dad, and no one in my family is in any way sort of medical or dental related. Mm-hmm. We had a family friend who was a dentist who owned his own practice. And we also had a neighbour who I babysat for who was an orthodontist. Oh. And so I started to look at them and just sort of look at what their quality of life was like, I suppose. And do they enjoy their career? Do they have a good work-life balance? And I started to think, actually, maybe dentistry could be the one for me.
Yeah.
I was really lucky that I got into Queen's. I was able to do some work experience with a family friend. Obviously, I continued babysitting for my orthodontist neighbour the entire time as well. And so I suppose I then just gained quite a lot of experience of what life was going to be like beyond university.
Yes.
every time the A-level results come around, it always brings me back to that time.
Me too.
Because you start to realise, like, once you get your A-level results, and if you do go into a career like dentistry and you've picked a course like that, you are a hamster on a wheel for the next 10 years after, because you just have to keep chugging on and jumping through hoops. And so I'm envious of them in one sense because they have that all ahead of them, but also in the other side of it, I think, oh my goodness, I don't know if I could necessarily go back. I don't have the energy for it.
The pace. I know, and it is obviously like such a different world to whenever we were at uni, because there's so many more things that they have to give headspace to that we never had to, which is
they were really lucky to go to university at the time that we did. That's not to say that they're not going to have a good experience, but it's just going to be very different.
Yes, absolutely. What made you realise that specialising in orthodontics was the route that you wanted to take, and how did you actually make that decision?
So I suppose when I was doing undergraduate dentistry, I really enjoyed ortho. We were really lucky in that the dental dean was an orthodontist. So he was quite keen to get everyone exposure to orthodontics, which doesn't necessarily happen at undergraduate level.
The spotlight was on it.
Yes, exactly.
Want everybody to love what you love. Yeah. That's what I feel like about pairing you. I'm like, love it.
So we were really lucky in that we had quite a lot of exposure, and I really enjoyed it. We did quite a lot of hands-on, and I just liked, I suppose it comes back to me saying that maths was my favourite subject. Orthodontics is very sort of, there's a strict procedure and you're going to get from A to B, and you know how to get from A to B, and it's very rare that something happens that's going to steer you off course.
Love that.
And I suppose the physics of it really enjoyed. And so once I graduated and then went to do my postgraduate education, it just felt natural to me that was where I was going to progress. I also had ortho for the second time during university, so I went back and forth to the orthodontist quite a lot.
The other from the backstage view.
Yes, exactly. And I think, having that for the second time round and actually going to that practice, seeing how it operated, I thought I can really see myself in this position. And how am I going to get there, basically? So I didn't get a spot for VT in Northern Ireland. I was devastated about that because I was a home bird. I lived at home during uni even. Mum and Dad would have been still sitting up at 4 a.m. waiting, coming in the nights out. But I just had it so easy and I loved it. And then I didn't get a spot in Northern Ireland, but I had also kept my options open and went to Scotland for some interviews.
Yes.
And I was lucky to get I think it was only one of 8 positions for the 2-year programme in Scotland. I don't think they even offer that anymore.
Yeah.
And so you do part-time in practice 2 days a week, and then part-time rotations in oral surgery, community dentistry, peds, restorative. And you're getting all this experience crammed into 2 years.
Why don't they do that now?
I know, honestly, it was amazing.
Yes.
And especially for CV building, you're ticking the boxes in a short space of time, getting all that exposure.
And genuinely trying it to see if you like it, because you could have this fantasy life that I want to do oral surgery.
Absolutely.
And hate it whenever you get in, when you get in there.
Yeah. So it helps you kind of weed out exactly what you don't want really early on.
Speed dating. Exactly. Dating and BT. I love that.
Yeah, it was brilliant. And I love my VT practice. But again, it was just, I was really lucky that my trainer didn't take life too seriously.
Yeah.
He didn't really put too much pressure on me. It was just go in and enjoy yourself, do a little bit of dentistry. And then I just met loads of really lovely people in Edinburgh. I met my husband in Edinburgh.
Yeah.
Edinburgh
is amazing.
Oh, I love it.
Yeah. It's such an amazing place.
And I was really lucky that all the opportunities that came to me were within Scotland and within Edinburgh, so I was able to stay. And so it helped us then put down roots to some extent, because that can be a little bit hard, particularly in postgraduate education where everything's a national recruitment system and you're kind of expected just to up sticks and go wherever the job is.
Yeah.
And so I was a little bit choosy about the jobs that I picked, but I was just really lucky that I was able to get each one that I wanted and be able to stay in the same flat the whole time.
Yeah.
It made us feel then like we had a little bit of family life.
Yes.
This was really lovely.
Because I think at the beginning, it is all, it's still, as you said, hamster wheel. It's still go, 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 career first.
Yes.
And that extra dedication that you need outside of your clinical hours to really feel that you have that experience to move on. There is so much further learning that goes into that foundation training as well. And
I would say it's a bit like doing your driving test.
Yeah.
You do not know what you're doing until you're out on the road actually doing it.
That's such a good analogy.
The way that orthodontic recruitment works is that you do have to have pretty much experience in every other specialty in order to get onto the specialty training program.
Right.
And so I was lucky that I ticked off quite a lot of the boxes in those first 2 years. So in the third year then, I was really just missing my MaxFax experience and orthodontic experience.
Okay.
And so there was one job in Scotland that offered both those. And again, it was part-time MaxFax, part-time ortho. It was based in Glasgow, but I was like, I'm going to go for it. I had a friend who had done the job 2 years before me. So she had given me all the tips of what to say in the interviews, what you needed for your portfolio. And I was really lucky that I got that post.
I think you're a professional manifester. I think, I love that.
Once I set my mind to it, it's hard doing it, and that's it.
Yeah.
And so I was really lucky I got that job. Now, I did have to commute from Edinburgh to Glasgow for a year, which was hard. So I was leaving really early in the morning and home really late at night. There was on-call, there was weekends on-call, overnights. And so you're exhausted, but I think it's manageable because you have a timeline, as in it's going to end at this point and it's fine. And so you really just keep your head down for that year. And then during that year, I was able to build my CV in terms of publications and audits and all those things that you need to do, so that when I arrived at the ortho interview, I'm like, look what I've done in 3 years. I'm ready for this next step. And then the year that I was applying for ortho specialty training, there was 2 jobs in Scotland and there was only 19 jobs in total. There was 180 people applied and they were being interviewed all in one day.
Yeah.
It was highly competitive. And
it's like the X Factor.
It really is. I don't think I've ever felt nerves like it.
Yeah.
And you basically go in and it's, like stations of different scenarios and things, and you bring a portfolio along. But I was really lucky. I ranked in the top 20 and I got my first choice, which was Edinburgh.
Great.
And so then we were able to stay, and that then was us set for the next 3 years, that we kind of knew where we were going to be. And I loved my ortho specialty training. Made some really sort of lifelong friends,
of course.
Yeah. And like some of the consultants, I literally have on speed dial. I phone them all the time, like, what would you do? I need help. It was a really special time. Of course, it was difficult as well because specialty training is extremely expensive.
My goodness, I could only imagine.
And I remember once we found out that I got into Edinburgh, the course fees for 1 year was £18,000, and I was on a 3-year course. And I just remember wandering around Princess Street, like, what am I going to do? And I started walking. I remember walking into like Santander and just asking, can I speak to someone about getting a loan? And they did bring me into an office and I explained what I was doing. And they just basically laughed at me. They were like, there's absolutely no way that anyone is going to loan you money to go and do this. And
I didn't even think about that.
Yeah. So I remember then just getting on the phone to pretty much anyone who would listen, like in terms of family and friends, just like, please, this is what I want to do. And so we were really lucky, my husband and I, that we were able to pull together and pay for it. And then there was a conversation that actually happened once I was in training with the university of, we're UK students, we've already paid for our dental degree.
Yeah.
This is a bit much. And so we were able to then sort of negotiate a reduction in the fees for the second year, which was really helpful.
But that's insane, actually, because I didn't really think about that, and I didn't really think about doing it so early on in your career.
Yeah.
Because sometimes people will go into general practice and then earn what they're going to earn in that way.
Yeah,
and
they've maybe got a little bit more cushion.
And do it. But if you know that general practice isn't for you, you're not going to put that love and effort in there if you think, I'm only doing this to pay for my specialty.
Yes.
And I really love that. I've said it like a couple of times, like that burn the boats analogy. Like we're doing this.
Yes.
There is no back door out of this.
There was no alternative.
Exactly. There's nothing else for it. You have to find the £18,000. Yeah. And if you want to find it, you're going to find it.
Yeah. I think I'm just so lucky that I had a very supportive and understanding husband who was, yes, this is what we'll do. And I think it's like anything, is how my career has gone on, that we both always see the bigger picture, and we kind of knew this is for the greater good, that it'll all work out. Yeah. But yes, I would not have been able to do it without his support at all.
It's fabulous. I love it. I love it. So that kind of pivot in a career doesn't come lightly. It's a big investment in every sense. How did you approach the training and upskilling needed to move into orthodontics full time? And are there any courses or moments that really help shape that journey? What is the format of the training really? Is it hospital-based?
It's hospital-based. You are sort of 3 days maybe in your dental school as such, and then 1 day in a peripheral hospital, and then another day at sort of a study day, and that will be taken by consultants now in Scotland. They operate a Scotland-wide programme, and it'll be a different centre every week, and they basically rotate around. Every Friday I would have went to Glasgow or Dundee, or if I was lucky it would have been in Edinburgh, and then that would be taken by consultants and there'll be a specific topic that we're going to do that day. And then in your peripheral hospital, you are doing just seeing patients in clinic. And then in the dental school, you'll have sessions where you're seeing patients, but equally you'll be doing some maybe NDT clinics, or you'll be shadowing. And so you just get a really good exposure, I suppose, to everything in the ortho world. But it is just a very controlled environment, because you'll just have your little set of, I think it was maybe like 100 patients that you had, that you put their braces on in year 1 and you're debonding them in year 3, and you follow them through that journey.
That's nice. And there's something quite exactly. That's lovely. And you don't get paid. Sorry, I keep coming back to the cash.
We spend a lot of money talking ortho, unfortunately.
So you don't get paid for any of that time in those 3 years that you did?
I did, yes. So I was on a UK specialty training program,
right?
Which basically means you have a training number. Okay. So you're recognised as an NHS member of staff.
Great.
So you get a salary. Yes, absolutely. So you get a salary, so you can live. But then the fees part come from being linked to the university, and the university is where you're going to get your degree.
I get you. Yes.
So you have to have a postgraduate degree in conjunction with your clinical experience that comes from the dental school, essentially. Now, I do think there has been some changes around that, but I mean, I'm probably not the best person to talk to about it. But I do think you can now do almost clinical only training,
right,
and not necessarily have to have a research degree on the side. I'm not quite sure if that's, please correct me if I'm wrong, but I do think there has been some issues around that, because obviously that's where everyone is really struggling, and it's becoming a little bit inaccessible to people. Because if, for example, you've been placed in a London hospital, as I say, it's national recruitment, so you could in theory be placed anywhere in the UK. You're placed in London, you're making a salary that's not even going to cover your basics, and then you're expected to come up with 30 grand to pay these fees. It then means that orthodontics, or any specialty actually, is only going to be accessible to a certain cohort of people. And I think the dental community are really coming together to say, actually, this is becoming unattractive. And it's not going to attract the right type of clinicians that we want.
And that's really important, because we need orthodontics is more popular now than ever. We'll get onto that in a second, but I can't imagine not every case is 6 month smiles. Air quotes. Like not every case. We need that skilled set of people, because I'm sure 80%, 90% of the time it goes right. Sometimes it goes wrong. You need to know what's going on in those cases and have that real knowledge base there to jump off and springboard off. Whenever you're doing this training, does that include any kind of orthodontics? So we're talking about like fixed braces, but also Invisalign aligner training, or do you have to do that separately then?
You have to do it separately. Now, I again think it has changed slightly since I was there. We did do maybe one Invisalign case each. I did mine on a restorative consultant. Wonder how she looks now. But a lot of the sort of private aspects of appliances are just not going to be covered by the fees, I suppose, that the NHS are going to have to then cover. So it was mainly fixed braces, but we're seeing surgical cases, cleft cases. Yeah. We're seeing all the weird and wonderful hypodontia, impacted canines. So we're dealing with probably the most severe malocclusions and the most complicated malocclusions. So actually, once you get out into practice, you're like, oh, this is so easy because I really know just be dealing with the crazy for 3 years. But you do get a really good exposure. And the Max Fax job gave me the exposure in orthodontic surgery. So you come out.
Is that just surgery where they break your jaw?
Yes.
I have seen one of those whenever I was at the dental hospital in Sunderland.
Yeah.
Fascinating.
Yeah. It's amazing.
Yeah.
It's just
and how it changes somebody's entire face.
Yes. It is totally life-changing for them. And I see patients all the time who I think actually orthodontic surgery is probably the best option for you. But my unfortunate position is that I am seeing them when they're 12 or 13. And I'm telling them, well, number one, it's a really hard conversation to have with them to say,
for sure, yeah.
You know, do you like how you look? Do you mind if I point this out to you? That's a really difficult thing to say, especially to teenagers nowadays. So much of what we talk about is aesthetics based. And so there is a certain way, I suppose, of trying to address that, but you really don't want to give a child a complex at such a young age.
Absolutely.
And then the other difficulty that you have is that if they are going to go down the surgical route, then the orthodontics really shouldn't be done until they're ready for surgery. And they're not going to be ready for surgery till they finish growing, which is 18 or over. And so you're then telling them you're going to have to live with this malocclusion for the next 8 years of your life, even though you're being bullied or you're feeling awful about yourself. And I just think the psychological impact that can have on that child at that age, I just don't even think we can really quantify.
Yeah.
And so I see my job almost as the middleman to say, okay, let's make things look a little bit better for now. I promise you the end goal is going to be so worth it. And you're almost becoming that person's confidant, I suppose, during that really difficult time in their life. And you're trying to keep their self-esteem up. You're trying to keep their confidence up. But it is really difficult. And I think particularly nowadays where waiting times are so long.
Yes.
And you're trying to tell them that, can you please hold off? And patients just want to get started with treatment.
Exactly. Everything's so instant now.
Yeah.
Nobody really knows how to wait.
No. And they just want you to make their life better. And it's really difficult for me to say, actually, you know, I can't do that for you because this is what you need instead. But there is a lot of cases where I will try and just camouflage the fact that they have this underlying skeletal discrepancy. And for the most part, patients are delighted at the end. And it's lovely to see their confidence grow, you know, because they can really see a difference. But there is definitely a small cohort of patients that definitely orthodontic surgery is the way forward for them.
Did you ever do anything directly related to that, or is that more of a Max Fax kind of?
So in my job after VT, that's what we dealt with. So I was in a sort of peripheral hospital outside Glasgow. And so our two main things were head and neck cancer, trauma, and orthodontic surgery. And so every Thursday it alternated between either a cancer patient or an orthodontic surgery patient, and you were in theatre for X number of hours. Watching surgery. So obviously the head and neck cancers are so interesting, but harrowing as well.
Absolutely.
And the patients are really just, because we would have been the people going to their bed to just do all their obs and everything before theatre. And we would have been there for the consent process with the consultant. And then the consultant goes away to have his coffee and you're left with that patient and they're saying to you like, am I going to die? What's my quality of life going to be after this? And that's really difficult when you're 24 and you're thinking, gosh, I really don't know what to even say to this person. But equally then you saw the nice side of it when you saw them recovering.
Exactly.
And then obviously being in Glasgow, the trauma cases were just crazy.
Maybe from Newcastle, right?
I definitely picked up a lot of stories along the way.
Yes.
And then orthodontic surgery, it was just so lovely to see the patients coming back. So obviously you'd seen them day of surgery. You'd see the prep that goes into how we're going to get from A to B and then do their operation, obviously come back onto the ward. They're so swollen. They do not look like what they're going to look like. And then you see them coming back to clinic every week for the next 6 weeks. And by the end of week 6, you're thinking, oh my goodness, that is a different person coming through the door.
I think even being able to tell that story to a patient is really powerful and impactful, because whenever you're recommending that treatment or whenever you're having that discussion, you can really say, I've been there with this person, this is how impactful it was for them, rather than just hearing about it.
Yeah, I think it's so obscure to someone when you first suggest it, because they will not have known anyone who has ever gone through that.
Very niche.
And there's some really good videos and resources online as well. And loads of Instagram pages actually of people documenting their journey with their braces, and then pre-surgery, post-surgery.
Yeah.
And so I always direct patients to that.
I love that. And I suppose that's one of the really fabulous things about social media as well. Orthodontics has had a real glow up recently. It's very much having its moment. It's been having its moment for a long time, really, I suppose. With more and more patients leaning towards some sort of orthodontic treatment now at any stage of life, how do you approach treatment planning? And when do you think it's better to refer out a case rather than keeping that case in-house?
Yeah, so for the most part, my referrals come from the general dentists, and by and large, the bulk of my referrals are going to be the under 18s.
Yes.
But I am obviously getting a lot more self-referrals from adults and referrals from dentists of adults who have either had orthodontic treatment in the past and didn't wear the retainers yet, or have never even, seen an orthodontist before and have never considered it until they've seen the likes of this sort of movement, as I describe it, online, of everyone getting their teeth done.
Yeah, teeth are the new boob job, apparently.
Absolutely. So I think generally what's happening is quite a lot of patients now are potentially going to see lots of lovely dentists about composite bonding, for example, and the dentists tell them, actually, you can't have this till we align your teeth. And sometimes that can be done with Invisalign, which I'm more than happy for the general dentist to do. But equally, then sometimes it is just that little bit more complex, and then that's how they end up at my door.
Yeah.
For the adult patients, the most complicating factor really is they're usually arriving to me with a less than perfect dentition. So they've had a high caries rate as a child, so they've got heavily restored dentition. They maybe have a little bit of perio as well, or have had perio in the past.
Yeah.
They've maybe been a smoker. Now they're a vape. They're vaping.
Vaping being of my life.
Why do they come in with it? And no good, at least hide it.
Look at my collection.
There's no shame. And so generally the ones who I'm seeing, they have all that going on. And so you have to then be realistic, I suppose, in what you can expect to achieve.
Yeah.
And so more often than not, I'm taking out teeth that I wouldn't want to take out normally. Yeah. I don't really want to take out a 6 and start closing up that space in an adult. But it's got an RCT and a massive MOD amalgam. My hand is forced. I have to take that one.
Yes.
And I have to then try and close that space.
And make it look nice.
Yeah. And so I always consent to adult patients that, look, this is compromised. This isn't what I would normally do in this type of situation, but this is what we have to do.
Yeah.
And are you okay with that? And so for the most part, the adult patients trust me, which is brilliant. But there are definitely then a smaller group of patients again where I think to myself, I can get everything in the right place, but this is still not going to look nice after, because you've really got all those little interproximal restorations from caries previously. They'll have gingival recession and black triangles. Yes. And I'm telling them, I can't avoid doing that. So you're now also going to need to invest in some post-orthodontic cosmetic treatment to make this look like how you want it to look. And so that's when I then start to have to refer out beyond. Now,
do you find people come into you likely with the hairdresser with a picture?
Oh my goodness, all the time.
Oh my goodness.
Yeah. Now, they won't necessarily have the picture, or they will tell me that they have the picture, but it's in their head. Yeah. And I really have to whittle down what are your expectations. And so I suppose sometimes I'm a little bit, again, like a middleman, because they've maybe come to me from their general dentist who maybe doesn't do a lot of cosmetic treatment.
Yeah.
But I am not the type of person that'll say, you need to go see this person for this. I'll always say, look, I can do this part, but you need to go back and speak to your own dentist about where you get all that other stuff done.
Yes.
Now, sometimes if they come from the cosmetic dentist to me, then that's an easier transition. I can just send them back to that person and I say, okay, this is what I can do. Can you now tidy it all up and make it look beautiful.
Yeah.
And I'm always jealous of that person because they get all the praise at the end.
They get the big reveal and everything. Oh.
And then I suppose then there are ones where I just know it's completely out with my competency and they have to go see the hospital consultants because it's just not something that I'm going to be able to deal with on my own. And equally, I see too many holes along the way where it could go wrong. And I think actually better having the backup of a consultant orthodontist, even if it is only for planning and it's not necessarily that they're going to have their treatment at the hospital, but just to have that little bit of backup from my end to say, I've done the right thing in this case.
Absolutely. And it doesn't happen like overly often, but sometimes in practice I would see like an upper 3 with loads of recession on it, mobility, after somebody's had ortho. It maybe wasn't the right orthodontic pathway for that patient, and I'm sure there's situations where there's no earthly way of knowing what's going to happen until you're doing it.
Yeah.
But that's a pretty scary place, I'm sure.
Yes.
To be without having that, I suppose, little network of people where you can send up the bat signal and say, I need help.
Absolutely. Yeah. And I think that's an important thing to learn along your career, regardless of what you go into, is always recognizing early when you might need help rather than getting into a sticky situation and going, oh, shit, essentially,
exactly.
What do I do?
It's like in Big Daddy when he just keeps putting the newspaper
over pretending it on the floor.
Yeah.
So I'm always an advocate of refer early.
Yes.
And even if that patient has to maybe wait a little bit longer to start, isn't it better in the long term in case anything does go wrong along the way?
And then you have that network of people around you, I suppose medical legally as well, because this is the thing, like obviously we talk a lot about this with perio, but like that's the thing, you just want to know that you've even ticked a box
absolutely
for a referral, even if the patient doesn't want to go with it, given that option, putting that option out there to say that it's maybe not that straightforward, because consent's massive now with everything, isn't it?
Absolutely.
Like even whenever we started, obviously consent has always been a thing, but now all the types of consent that need to go over for I'm sure anything ortho implants.
Yes.
That's huge now, isn't it?
Absolutely.
That's a lot of
I think, exactly. And I think just showing that you've had the foresight to recognise that this wasn't going to be straightforward. I think if you can demonstrate that, then you can sleep easy at night, at least, if anything does go wrong.
What sort of training then is like more basic, for want of a better word? You can do, how long would it take as a clinician if you like the idea of ortho, but don't want to maybe go down the route that you've went down, but you still are interested in adding that to your scope of practice.
Yes.
What is a good sort of base level of orthodontic training you think to be able to go about your day-to-day in practice?
I think a lot of orthodontic learning is really going to come from experience. Like I say, the orthodontic specialty training is set up in such a way that you put all the braces on in year 1 and you take them all off in year 3 and you watch them through that journey. So come year 3, I haven't really done a bond up in 2 years because I've been watching them along the way. And so it's only really at the end of that things start to click of, oh yeah, now I know why we did that back in year 1 because this is what we've got to in year 3. And I feel like you need that block of experience of watching all those patients and planning along the way to actually sort of understand why you're doing something.
Yes.
And so I'm not necessarily sure that there's a course that you could do that's going to give you that experience. You can do a course that's going to give you the theory and the knowledge. But I think unless you're doing it day in, day out for a block of time with a really sort of decent number of patients, I'm not necessarily sure that you'll ever gain that confidence.
Yes.
Now, that's not to say there are plenty of people out there, non-specialists, who are doing really good orthodontic treatment. But I suppose it's something I think you have to commit to fully.
Yes.
I'm not necessarily sure it's a specialty that you can dabble in the same way that someone can't really dabble in implants.
No.
Can't really dabble in just doing the all bit of composite bonding. It's something that you need to be doing all the time.
You need to pick your lane, I think.
Absolutely.
This podcast is sponsored by DMI. At DMI, we understand that running a successful practice takes more than excellent patient care. It requires the right tools, knowledge and support. That's why we supply a full range of premium dental equipment and consumables from leading manufacturers. With 24 local engineers fully supported from our offices in Lisburn, Dublin and Cork, we aim to provide the best engineering support in Ireland. Our team of 8 consumables consultants are also on hand to visit your practice, offer expert advice on products and promotions, with next day delivery from our warehouse. But we don't stop there. By partnering with leading manufacturers, we provide continuous training, technical expertise, and tailored solutions to help your practice stay at the forefront of dentistry. Whether you're upgrading your surgery, investing in digital dentistry, or simply ensuring smooth day-to-day operations, we are here to help you work smarter, deliver better patient outcomes, and grow your practice. With DMI, you don't just get a supplier, you get a trusted partner dedicated to your success. Starting your own practice is a massive move and no small feat. Lisburn Orthodontics is such an exciting venture. What was that leap like for you, and what advice would you give someone thinking about going out on their own?
So owning my own practice was never on the cards really for someone who's been so focused. It wasn't something that I saw myself doing. But what happened was when I came back to Northern Ireland in 2018, I had started working for a corporate, and basically they wanted me to go into their general practices and do a little bit of ortho. But these were practices that had never had ortho before. So I essentially arrived, number one, not knowing anyone in Northern Ireland.
Yeah,
not tough. Yeah, not knowing the system, and basically just learning how to walk in ortho. And now I was having to basically set up an ortho practice within a general practice.
Yes.
And so I quickly realised this isn't going to work for various reasons. But I was pregnant with my first child, so I was kind of just muddling along trying to make it work.
Yeah.
And then an opportunity came up with Total Orthodontics on the Antrim Road.
That's in my crew, Total Orthodontics up the road.
And so basically I saw the job 6 weeks after I'd had my first child, and I thought, I have to go for this because it's a specialist practice and, you know, it's going to be what I want.
So did you start like really soon postpartum?
Literally arrived for the interview with Arthur in a car seat, like 6 weeks old. And basically the practice was so well run. So I don't think it had been bought over long.
Yes.
And the practice owners were still working there, and it was military operation. And so I really got to see how a good orthodontic business works and how it functions.
Nice.
And so I really just took that opportunity to sit back. Obviously I'm working, but I'm also observing and just saying, like, this is a really good business plan, essentially.
Because it is a business. Think about it as a business, just as much as anything else.
Yeah, absolutely. And so I really enjoyed working there. And quickly after I joined, I fell pregnant again. So I was employee of the month. But by the time it came around then to the year after, and I had Betsy, it was COVID. So the practice was closed. And so my husband was at home as well. And we were sitting one day and he said to me, have you seen this ortho practice that's for sale? And I was like, no, why would I be even looking at that? And so he was like, well, maybe you should just go and find out.
Your husband, he's your biggest cheerleader ever.
Absolutely, he really is. And so I was like, well, maybe I'll just give it a shot, because I was, if I'm honest, just bored at home, and I had 2 children under one. Like, it was just insane. So I needed to basically claim a little bit of life back.
Yeah.
And just do something for myself. And so I went to view the practice towards the end of 2020. The process takes a little while, but eventually then took over the practice in October 21. But of course, that whole time I've been working in Antrim Road, building up my cases there, and then took over the practice and just basically hit the ground running. I think I had set up the Instagram page maybe just before I took over the practice, because I knew myself, no one knows me here, because I haven't done any of my training in Northern Ireland, so no one knows who I am. So they're not going to refer to me unless they know me.
Yeah.
And so I sort of became acutely aware that I have to build a brand before I buy this practice. Otherwise, it's never going to be successful.
Yeah.
So once I took over the practice, I had to get the word out there quickly that I'm here. I've got no patience.
Well, that probably forced your hand with social media.
Absolutely.
I don't know anybody that's like, oh yeah, I can't wait to put myself out there and be really vulnerable. You just had to do it.
Yeah, because it was sink or swim. We'd invested so much money in buying the practice. There was no option. It couldn't be not successful. It had to work. And the only way I felt that it could work, particularly in post-COVID times, was advertising.
100%.
And the best way to advertise at this point in time anyway is social media.
Yeah.
And so I knew that I have to get my name out there, because I suppose we were coming out of that era, where of that generation of dentists who just all rubbed each other's backs a little bit, and everyone kind of knew each other and helped each other out.
Definitely.
And we're not in that generation anymore. And there's definitely a newer crop of dentists that have come in, but the older ones are still there. And the older ones will be like, who's Emma? Why would I send my patients to her? And so I had to try and build that trust really quickly to get the referrals up, to get the business in the door.
And I suppose portfolio is the way to do that.
Absolutely.
Yeah.
So I was just conscious of just need to get my name out there. I went around, visited all the practices, and I pretty much travelled as far as Middlester, right down to East Belfast and everything, and basically just spread the word as much as I could to say, like, I'm here and I have no waiting list. And
which is the thing.
Yeah,
that's the thing.
Absolutely. Post-COVID, that was your key. And because everywhere else was just so busy dealing with their patients in treatment that they hadn't been able to see for 6 months.
I've actually done that after maternity leave whenever I first came back, because I usually always have a waiting list, and this was the only time I didn't have one. So whenever I was on social media, I was like, you can get in for hygiene and you can get in this week. That's such an important thing to say if you are building up your brand.
Yeah. And thankfully, the dentists heard me,
Yeah.
saw me, and sent the patients. And
that was just felt so good.
Yeah, it is. And I think it's one of those things where there were some really dark times, I would say, in the beginning, where you really start to question, have I made the right decision? Am I doing the right thing? Because I still am working 5 days a week. I have 2 young babies at home.
Kids,
We've invested a lot of money. Orthodontics doesn't make money in Northern Ireland for the first 3 years. No, just to come back to cash.
I think it's important for people to know that.
Yeah, there's no money coming in, but all the money's going out. And in order for me to...
That's scary,
Yeah, in order for me to build the business that I could see happening, I had to obviously employ the staff. I had to have the equipment. I had to have all the materials there. So I've put a huge amount of expenditure in, but nothing coming back in return. And you really have to hold your nerve and know that it's going to come. But there does come times where you wobble and you think, it's like, is this ever going to happen for me?
But manifest, Emma.
Absolutely. I think, like, I've spoken to Alan about this before, because we both really believe that if you truly understand your business, number one, but also have faith in what you're doing, it's going to come good. And for me, that was the case, where even when I was going to buy the practice and I had to go to see an accountant and a solicitor and a bank manager, and I'm explaining the nature of the business of orthodontics, and I'm telling them, okay, I'm going to put braces on all these patients, and this is how much it's going to cost to do it. I'm not going to get the money to pay for that until year 3 in business. Is that okay?
Yeah. I say, no, that's not okay. But it is, I suppose, like going to an investor meeting. It's kind of like trying to get that, I forget what the name of it is. My husband's in tech. He'll be really annoyed that I can't remember that. The Series A. It's trying to get that somebody to back you and back your vision. And that's a mindset thing.
Yes.
Because again, it is personal brand. They're buying into you. Yes. They're not buying into Lisburn Orthodontics. No. They're buying into Dr. Emma.
Yeah.
And that's
what I'm always aware of and conscious of, is that my business is me, essentially, which is great for lots of reasons, because it gives me total control then of where I want to take the practice. But equally, there's quite a lot of pressure then, because it is me, and I have other things that might happen that make it that it's not attainable for me to continue that business in that way.
Yes.
But for now it works. But yeah, you're really trusting people to buy into you and the brand. And I suppose in those first couple of years, you do have to be really strong and just have a really good gut feeling that this is all going to work out. And thankfully we're kind of coming out of that stage now, because we're into year 4 business. And, you know, now I see, okay, I'm so glad that we've put in the hard work in those first couple of years, because,
absolutely,
you know, it's working now.
And congratulations, you've had a business for 4 years, which not a lot of people can say, which is incredible. So I suppose the big thing is just mindset, believe in yourself.
Absolutely.
Keep stepping forward, even when you've got shaky hands.
Yeah.
And
there's a quote I saw actually there last week. Don't stop when you're tired, stop when you're done. And that's kind of,
love it.
That is essentially what I have lived to for the last 6 years.
I feel like all women live to that a little bit. A little bit. And I think that
we're always tired.
Our MO. We just gotta have to keep going. You've built not just a dental practice, but also a personal brand that's grown through social media. I'd love to hear more about the business side of running a practice, what goes on behind the scenes that people might not realise, and how you have used social media strongly to grow your business and connect with patients.
Well, I suppose in the early days, I was doing everything, okay?
Yes.
I had all the hats. So I did the ordering. I paid all the invoices. I paid the staff. I did all the recruitment. And I did all the clinical work. And there was even days I answered the phones. So I was booking appointments. And
project managed opening a new practice.
Yeah, you're kind of doing everything. And one moment that really sticks out in my head was my first RQIA inspection. Because obviously the first one's the big one, where you have like an interview where it's like, are you able to own a practice?
Yes.
And so there's obviously quite a lot of prep that goes into it. And the practice I had bought over was very much an analog practice, and I was basically putting everything to digital. So I had to start from, you know, zero and do everything. And I think it was in February. So I took over in the October. The RQA was scheduled for the February. And I was like, right, you know what? Let's enjoy Christmas. And then after Christmas, I'm going to get my head down and get all this sorted. And then literally like 2 weeks into January, my little boy got chickenpox, which was then just chaos. Yeah. But of course, the way chickenpox works is then the second child doesn't get it for like another 2 weeks after that, which then it was like 6 weeks of just hell. And then, of course, it was RQIA, and I had a member of staff off with COVID, and I only had 2 nurses at that stage, another nurse off on annual leave, and it was just literally me and my receptionist. And I just basically had to abandon the kids at home with my mom. And just basically I went at like 6 a.m. to the practice on a Saturday morning and stayed there till like 10 p.m. that night, just doing every single little bit, every bit of documentation that needed to be done for that inspection.
Yes.
And just blasted it. And then come the Monday, I was like, do you know what? If it's for me, it won't pass me kind of thing.
I've done everything I can do.
Yeah. Basically, you just have to pour everything into it. And so once I got that first inspection over me, I thought, do you know what? If I can survive this, I can pretty much do anything after that, because it was hell. And so as the practice then grew, I was then fortunate that I was able to then build a team who I could then trust to give some of those hats to.
Does it feel whenever you've had that level of total control over something? Because I'm a bit like that as well.
It's hard.
How does it feel delegating that out then?
I think it is tricky, and I would still say I definitely struggle with delegating. My husband would definitely say that. You'll moan at your husband for not doing things, but you'll say, oh, you're not doing it the way I do it.
And you'll be like, it's fine. In real life, you're like, it's fine. And then you're like in your car, your eyes twitching.
But no, I am really lucky with the team that we have at Lisburn Ortho now. Pretty much everyone that's there, they just feel like family to me, and I trust them implicitly. And so there's things now that I just wouldn't even give a second thought to. Like my head nurse does all the ordering. I would never even have to say to her, did you remember to do that? Did you remember to get this? It's just done. Practice manager is excellent. We've had 3 RQIA inspections now. They've all been passed with flying colours, thanks to his hard work.
And the relief with that and the mental load is huge.
Absolutely, because I truly do say to people, I do not think about work when I'm not at work. There'll be the odd thing that clinically that I'll be thinking, oh goodness, that happened, or I should have done this. But from a business point of view, there's very little that I really take home with me at the end of the day, and I really credit the team with that.
Yeah.
Because I trust them that if I've asked for something to be done, it's done. But equally, they're doing things that I haven't even asked them to do.
Yes.
That they know are going to make my life easier. And so that's a huge relief. And it's something I appreciate that not necessarily everyone has.
Yes, and it's so true that a lot of people can't really let go of that. And I think that's actually amazing that you've been able to really push yourself to do that.
Yes.
Because that's a hard place to get to.
Yes.
And I don't want that to go unnoticed, that hasn't happened overnight. That's been trial and error on your part to get to that place. And I think that's really special to have that with your team, and I'm delighted that you have that. I recently learned more about orthodontic therapists, Emma. And I had a fantastic Rebecca Hamilton on. I'm sure you maybe, of course, know Rebecca as well. And honestly, I love the role so much. I'm obsessed with it. It blew my mind, actually, as to how massive the scope of practice was. Far greater than I ever anticipated it would be. What's it been like working alongside orthodontic therapists, and how has it changed or streamlined the way you work day to day?
So orthodontic therapists have been key for me in growing my business.
Yes.
Okay. That was something, again, that I quickly learned in the specialist practice where I was working.
Okay.
Where I saw that this is how you build a business, and this is how you get, patients into treatment. And so when I then opened my own practice, I knew that I needed a therapist, because I see my role as treatment planning and getting the patients in the door.
Yes.
But my hands and skills are not best placed behind the chair all the time.
Yes.
Because if I'm doing that, then my waiting list is growing because I'm not getting patients in.
Exactly.
And so learning how to delegate that task is certainly something that's difficult to overcome, because obviously up until that point I was doing all the treatment and all the planning, everything myself. And now you're going to trust someone to work in the same way that you work.
Yes.
But I've been really lucky with the therapists that we've had. And then I was really fortunate to be involved in training my own therapist.
Wow, that's good. That's again another way to look at it as well.
Yeah, so I had a nurse, and she was really keen to do orthodontic therapy. She was more than capable. I just knew she is going to be fantastic for this role. And so we were really lucky. She got into Manchester University for orthodontic therapy. This would have been back in 2023. And so then that then actually gave me a new aspect, because I was then learning how to be a trainer and how to be a teacher.
And communicate how you want it in your head.
Yeah, absolutely. And that's not necessarily something that comes natural. Especially, I find sometimes it's hard to vocalize what I want to achieve. I know how I'll do it, and I'll know how to get there, but actually telling someone else how to do that or why you're doing that is really, really difficult.
Yes.
And so Nicole was fantastic. She was an excellent student. You quickly see when you can offload those patients coming in and say, okay, you can get your bond up next week with our therapist, then your whole business then just starts to move so much smoother.
Because you're in a place of growth then.
Yeah, absolutely. And so therapists have really been key for me. Nicole, she hit the ground running. So she was pretty much working to the same standard as the other therapists within no time at all. And in terms,
how many therapists do you have?
So I have 2 therapists.
Amazing. Yeah.
And so it is very busy day to day, because obviously you're supervising all those patients that they're seeing, whilst also seeing the new patients coming in and treatment planning. But it does, I feel, give you slightly more control in that aspect then, because I trust both therapists implicitly, but they're both very good at recognising Emma needs to see that this visit.
Yes.
I need to know what I'm doing for next time. I feel like that I have better control over all the cases then, because I know that I'm going to see every single one of them because they're calling me in.
Yeah.
Which you might not necessarily get, I suppose, if you had an associate.
Yeah.
So I've always sort of weighed up what's going to be better for me. And at this point in time, therapists are the better way our business is going to go.
I think it's a really forward thinking way of having the full team be utilised as well. And that's kind of very similar to us as dental therapists.
Yes.
That really should be the mindset. If you have a dental therapist as well, you're going to do it how I would do it. You're going to be booked in with them. Happy days.
Yeah.
And I think that's going to be really interesting for dentists in general practice to hear that, because that's applicable to dental therapy as well.
Yeah. So, I think too, just even for team morale, to be recognised that, that I trust them to go off and do your job. Yeah. I know that you know how to do your job. And you're making my life easier, and recognising that, then it's really good for the team in terms of I feel trusted, I feel needed, and I enjoy working here because I've got that autonomy.
Exactly. I think that's so important, and I think that's obviously something you do really well across your whole team as well, Emma, which is great. And finally, let's talk about what's coming next. What's on the horizon for you and Lisburn Orthodontics? Any big plans for the rest of 2025 and beyond?
I feel like 2025 has been the year where actually I've just been enjoying the growth that the practice has had.
What you've built.
And we're in a period of stability just now, and I never really like to say that because then something's going to happen that rocks the boat. But it's really just been a case where this year I felt I've just taken my foot off the pedal ever so slightly because up until this point, from university, from your GCSEs, quite literally from GCSE, from the age of 16, it has been go, go, go. And I've just got to a point now where I'm just enjoying life. My children are at such a lovely age. And my husband has just bought his own practice. And so
what does your husband do?
He's a dentist as well. Yes.
Fantastic.
With predominantly implants. So
fantastic. That's incredible.
So I'm now happy to go back to, okay, my business is working well and I enjoy my clinical work. But I'm going to just, enjoy home life and let you now go and do what I've done for the last 5 years. And I think you do need that because I appreciate he's going to have, although his business is a different model to mine and it's more established, he's still going to have those trials and tribulations that I've had for the first couple of years. And so you really need someone in your corner who's going to pick up the pieces around to facilitate you to be able just to go and focus on that. And so I feel like that's where I'm at just now, where everything is working well in Lisburn. If it's not broke, don't fix it. And it's working well. So let's just keep going, but let's see where we can take it as well.
I think that's so important to say that you do need support, and there will be seasons where you're the supportee and the supporter, and those roles can switch and move and be fluid. And I think that's amazing to be able to. It's an amazing gift to receive that your partner's been able to do that for you. And it's an amazing gift to give that you can now do that for someone else as well. Would you ever like to create super practice, ultimate ortho implant?
People ask us this all the time. I don't think so. I think orthodontics works as a little singular unit, referral only, just not out on our own as such, but not in competition really with anyone else. And I think sometimes once you get into those practices where everything's under one roof, I can totally understand from a patient journey perspective how that could be obviously a lot more attractive. But then when my business is so based on external referrals in, I feel sometimes then actually I might lose business because if they come to me for ortho, are they going to go elsewhere for XYZ as well? And so it's maybe not as attractive. And also I think just for home life.
She's left us to talk about.
Exactly. Let's just keep it separate. We're very different people. And I think we'll both be happier in our own little corner.
I would be too, Emma. Would you ever like to do anything education based after kind of dipping in with the orthodontic therapy?
So I was really lucky this year. I've joined the teaching team at the British Orthodontic Society. So I now deliver courses. I deliver courses on IOTN and PAR scoring. Not the most glamorous, of subjects, but it is enjoyable. And I think even just getting everyone together in a room for a day, you always end up having a good laugh. So I've really enjoyed that aspect. So we offer courses twice a year. Usually one's in London and then another one will be in another part of the UK. And so we are running a course in Edinburgh in October, which will be great because then I go get to see my friends at the same time.
I'll link it in the show notes if it's not already fully booked.
And then we'll do London at Christmas as well. We usually do a course in around December, January time.
Great.
And then I was also asked to teach the new cohort of orthodontic therapists in Northern Ireland.
Because that's just started.
So we went to NIMDA for a day and delivered various topics to the therapists. But that was really exciting to be involved in because it's the first time it's run in Northern Ireland. And so everyone is just super keen for it to be successful because that'll be such a game changer for orthodontists if we don't have to send our trainees to the UK for training. If we can have it in-house, it becomes a lot more accessible and a lot more attractive to nurses if they do want to progress in their career.
And I think that's amazing. And I can just imagine, you're so calm. I can just imagine being taught by you and everything feeling like nothing isn't achievable. So I love that. Emma, thank you so much. I think this has been such a brilliant chat. I've loved it, not just from an orthodontics perspective, but from a business perspective, and also from really championing your team. And that's a lesson that everybody can really move forward with. So thank you so much.
Thank you so much for having me.
You're welcome. I have absolutely loved this conversation with Emma, from specialty training all the way through to opening your own practice. There were just so many brilliant takeaways. We covered everything from orthodontic surgery to the business side of running a practice to orthodontic therapy, and just Emma's sheer determination to show just how rewarding and fulfilling that this career in dentistry can be was just amazing. I'm going to pop loads and loads of links in the show note, so definitely have a click on those so you can find out a little bit more. You can follow Dr. Emma over on Instagram at Dr. Emma McCrory, and her practice at Lisburn Ortho to keep up with everything that she's doing. If you're curious about orthodontic therapy, or like me, you're obsessed with orthodontic therapy now, and you want to dive a little bit deeper, I'd really recommend going back and listening to Season 2, Episode 5 with Becca Hamilton, who gives us some really brilliant insights on what the course involves and how you can really bring this to practice. So I will link that in the show notes as well. And as always, on Instagram, you can follow at Conversations with Dental Friends for all things podcast related. And I'm over there too at Homegirl Hygienist if you want to connect with me. Thank you so much for listening. I'll see you next week for another conversation with my dental friend.